Hello everyone. This is a class regarding basics of dermatology and clinical examination. I'm Dr. Shricharith.shetty, Assistant Professor in Department of Dermatology, Shema. So the contents on which we'll be discussing these topics include we'll be talking about something about dermatology, its embryological aspects, and layers of skin, and what are the cells in epidermis, dermis, and some of the basic skin lesions, how you should look into them. That's it. Okay. I'll be very brief on them. I will not be going in detail regarding this. So dermatology has evolved from for a very in a big time. It was the kind of branch which earlier we used to say just with the small room, examine the skin, and most of the conditions were associated with an itch, and most of them used to make fun that dermatologists are not actually doctors who just see some few small conditions, and most of the treatments are limited to steroids. But not so nowadays. Dermatology has evolved a lot, and we deal with various conditions, various aesthetic conditions, various dermatological conditions, and we also take care of conditions such as leprosy and sexually transmitted disease. So there is a big field, big bench, and you should know something about dermatology in your curriculum. That's what I'll be telling in class. So coming to anatomy of skin, you all know it's one of the largest. It's the largest organ system of the human body. This is the largest organ system of the human body, measuring about 2.12 square meter, and it weighs almost up to 4.2 kg. When we talk about skin, it includes hair, sebaceous gland, eccrine glands, nail, mucous membrane. So it's not only the skin, we also deal with conditions which are related to hair, which conditions which are related to sebaceous glands. Sebaceous glands are those glands which are responsible for sebum production on our skin, the one which gives oiliness to the skin, and the eccrine glands, which is responsible for the sweat production, and the nails and the mucous membrane. So coming to the layers of skin, we have epidermis, dermis, and subcutaneous. Epidermis is the topmost layer which contains stratum basale, stratum spinosum, granulosum, corneum, whereas the dermis is the lower layer which again contains papillary dermis and reticular dermis. Then we have subcutaneous tissue. So if you want to remember what are the layers of skin, remember it as epidermis, dermis, and subcutaneous. And three things. Epidermis is the topmost thing, dermis is middle, and then we have subcutaneous. So in this figure, you can see this the topmost part is the epidermis. Then you have dermis, where you have all the vessels, inflammatory cells, and muscles. And then we have the fat in the lower and the subcutaneous. There are certain other cells such as melanocytes in the skin, which you should know. Melanocytes are those cells which give color to the skin, and they are present in the along the basal layer. And this is a melanocyte which is giving the color to the most of the skin cells. So, so they form melanocytes. How they act is they form melanin. Uh, through a different biochemical reactions where certain components such as phenylalanine is converted to tyrosine and then to dopa, and dopaquinone giving rise to pheo and eumelanin. This is controlled by genetic factors, ultraviolet rays, and hormones. So there are the different factors why the skin color is different in different individual, because the melanin content is varies from individual to. So what is the importance of having melanin in the skin? It imparts color to the skin and hair. It protects the skin from ultraviolet radiation, and also it is a biochemical neutralizer of toxic free radical oxygen derivatives. There are certain other cells such as Langerhans cells, which are mainly an immunological cell, which is a type of macrophage. Then we have Merkel cells, which are mainly the fine touch receptors. They detect mechanical deformities of epidermis. So what's the function of epidermis? The function of epidermis being it acts as a barrier function. It helps in permeability of certain substances through the skin. It maintenance of the fluid and electrolyte balance, thermoregulation, pigmentation, and immune function, and sensory acts as a sensory receptor, and vitamin D synthesis also it helps. So the function of epidermis is it acts as a barrier function. It helps in permeability of certain substances, and also it helps in maintaining the fluid and electrolyte balance in the body for temperature management, pigmentation, immunological function, sensory and receptor, and as also as a vitamin D solvent. There are certain other parts of the epidermis which you should know, that is hair follicles, sebaceous glands, sweat glands. So what is hair? Hair is something which is component of skin which is found in almost entire surface of the body, except palm soles and glans penis, clitoris, labia minora, mucocutaneous junction, and distal portion of fingers and toe. What are the types of hair we have? We have lanugo hair, which is fine, soft hair in fetus. We have vellus hair, which is fine, short, non-medullated hair over the most parts of the body. And then we have terminal hair, which is long, coarse, medullated over the scalp, beard, and body, depending upon the age and gender. So these are the three types of hair: lanugo hair, vellus hair, and terminal hair. Lanugo hair is the one which is found in fetus. Vellus hair is found in almost all part of the body. The terminal hair are those which are thick hair, which is found on scalp and in the underarms and in the. So hair grows in a cycle. It usually has three cycles, important cycles, that is anagen, catagen, and telogen. Anagen is the phase during which the hair grows, and the catagen is the phase when which the hair gets a signal to fall, whereas the telogen is the phase when which this hair which has got the signal to fall will rest in the scalp for a certain period and then it falls. So if you see, if the hair starts growing today, for example today, then it grows for a period of 2 to 10 years. It varies, but it grows for a period of 2 to 10 years. If some hair which has started growing this year in 2020, this ideally has to grow for around 2 to 10 years. And then after 10 years, it enters into a phase called catagen, in which it stays for around 3 weeks. When it gets a signal that you are about to fall, then it rests without doing anything. That is called as telogen for around 3 months. So after 3 months it sheds and the new hair starts growing over there. So this is what is hair cycle is all about, and in an average person around 100 hair loss is considered to be normal. Then we have sebaceous gland, which is the one which is related to production of the sebum, that is oiliness on the face, and there are many conditions which are associated with sebaceous gland, such as acne formation, pimple, which is a very common thing that we call, and seborrheic dermatitis, the anthrop is also associated with sebaceous gland. Then we have certain other glands such as eccrine gland, which secretes sweat secreting glands, and then we have apocrine glands, which is like apocrine glands, which has features of these are vestigial glands, not so it doesn't have any important function. Uh, so eccrine glands are sweat glands which are present almost all over the body except over the lips, external ear canal, and labia minora. Whereas apocrine glands are vestigial glands which are present in the axillae, nipples, periumbilical area, and perineum. Then coming to dermis, it is the second part of the skin which is mainly consists of brown substance which holds the skin together. That's about the anatomical aspect of skin. Now this is the most important thing what I'll be dealing now. Uh, I'll be talking about various skin lesions. This is what you should know while describing a skin lesion. When you see some patient who has a skin disease, you should be able to write it down or present it to someone. And when you are presenting it to someone, this is the more clinical way of presenting. You know this. Always we classify skin lesions as primary, secondary, and special. What are these primary lesions? What are secondary lesions? What are special lesions? Primary lesions are those which are there at the beginning of the disease itself. It is a presentation of the disease. So usually it is like we call it as macule, papule, nodule, plaque, vesicle, bullae, pustule, and cyst. Whereas the secondary lesions are those changes which happens over the time in the lesion. This because of the course of the disease. That is what is secondary lesion. These are scales, crust, erosion, ulcer, excoriation, fissure, sinus, scar, lichenification, and atrophy. Then there are certain special lesions which are importance of which is if they are seen, you see certain special lesion, it is very diagnostic and helps in making certain diagnosis straight away. Okay. So what is first we will talk about macule. Macule is a circumscribed alteration in the color of the skin of any shape of the circumscribed alteration in the color of the skin. It can be of any shape. It is usually non-palpable and without depression. So these are just a small area of color change in the skin is called as macule. Which the color change can be hypopigmented, that is less pigment, or it can be hyperpigmented. For example, this it's a vitiligo case of vitiligo where you see depigmented means there is no pigmented macules. These when you touch, they are not raised, they are not depressed, these are just change in color. That is what is macule. Okay, these are hyperpigmented macule in melasma. Second is papule. Papule means it's a small, solid, elevated lesion which is palpable. Means here the macule. In macule, when you touch the lesion, you can't feel anything, whereas in papule, it's actually slightly elevated, but the size is very small, which is 0.5 centimeter in size, formed either by localized proliferation of tissue or infiltration with inflammatory cells. Papule size 1 to 2 millimeter are called as micropapules. Papule, look, this is a papule, which is a what? Also commonly called verruca vulgaris. This is a papule, raised lesion, which is less than 0.5 centimeter. This is another example of papule or lichen planus condition. Another papule which is pearly white lesion which is called molluscum contagious. So what is nodule? Nodule is something solid elevated palpable lesion more than 0.5 centimeter. We spoke about papule which is elevated lesion less than 0.5 centimeter, whereas nodule is something which is more than 0.5 centimeter and it is slightly deeper component. It will be slightly deeper component also in that. These are the pictures of papules and nodules. So plaque is something which is solid and elevated and palpable lesion more than 1 centimeter in diameter with flat plateau-like surface. Here, what's the difference between nodule and plaque is that both are raised lesion, both are more than 1 centimeter, 0.5 or 1 centimeter, but plaque is more a flattened lesion, whereas nodule is slightly raised and dome-shaped lesion. For example, it's a psoriatic lesions. These are plaques. Okay, plaques are something which is more wider in aspect and herpes is an example. Pemphigus group of disorders, bullous pemphigoid. Pustule is something which is a circumscribed raised pustule lesion, prevalent exudate containing either cellular debris or leukocytes or bacteria which may be sterile. Pustule is something which contains pus in it. It's a small group, small lesions which contain pus in it. Example, bacterial folliculitis, pustular psoriasis. Then we have cyst and abscess. Cyst is something which is a closed cavity or a sac that has epithelial, endothelial or membranous lining and containing fluid or semi-solid material. Example is sebaceous cyst. A closed cavity or sac that has epithelial, endothelial or membranous lining. Abscess is a localized accumulation of pus deep in the dermis or subcutaneous, usually not visible on the surface of skin. It is erythematous, warm, tender, fluctuant nodule from staphylococcal or streptococcal. Those were the primary lesions. Coming to secondary lesions are those which is on scales, crust, erosion, ulcer, excoriation, fissure, sinus, scar, lichenification, and atrophy. Scale is something which is a visible exfoliation of flake of stratum corneum. Morphology varies with the type of the skin disease. For example, silvery white loose scales are seen in psoriasis, fine powdery scales are seen in pityriasis rosicolor, fish-like scales in ichthyosis, and colorate of scales in pityriasis rosea. So the scales are something which are visible exfoliation of flake of stratum corneum. Means it's a very superficial removal of skin, like as if the skin is growing more faster and the dead skin is accumulating on top. That's what is. Crust is something which is dried up exudate. Whatever is the secretion is there on the lesion, it gets dried up and forms a crust. A removal of crust usually leaves behind an ulcer or erosion. Erosion is a raw, moist lesion left from the complete or partial loss of epidermis or mucous membrane. Only when the epidermis, just the top layer of the skin is lost, we call it as erosion. Dermis is intact. Dermis is intact and has not no problem, but just the top epidermis is lost. This is called as erosion, and this heals with scar, without scar, unless there is any infection in it. Example is ulcer is something where the damage is more deeper, so it involves epidermis, also it involves dermis. So that is why it heals with scarring. That is ulcer. Excoriation. Excoriations are linear or circumscribed erosions formed by surface excavation of epidermis due to scratching. Whenever there is intense itching, people tend to scratch, and when they scratch, they remove the epidermis along with their nails. So that leaves what it leaves behind is called as excoriation. Then you have fissures. Fissures are something cracks, very common. These are linear triangular crack in the skin or mucosa and can be superficial or deep. Mm. Deep fissures are painful, common over the palms and soles due to the thick stratum corneum. Example is monoclonal psoriasis, keratoderma, and irritant contact dermatitis. Sinus is a tract connecting a deep cavity to the surface of the skin. Contents of the deep cavity are usually pus and epithelial dermis. These contents drain to surface when such channel. Scar, it's a proliferation of the fibrous tissue that replaces the normal collagen after the ulcer involving the reticular dermis heals. So these are something formed after the ulcer heals. Epidermis is thinned and wrinkled and redneck-like hair are destroyed. We have hypertrophic scar and keloid. Hypertrophic scars are usually present along the line of incision, whereas the keloid is the one which goes away from the line of trauma or incision. Lichenification, it's a triad when the skin is thickened and its skin markings are more prominent and it is hyperpigmented. It's a triad of thickening of the epidermis or dermis and the accentuation of the skin markings and hyperpigmentation. This is commonly seen secondary to the condition where there is a lot of itching because of the chronic scratch. Atrophy is a condition where there is a loss of cutaneous mass or diminution in the size of any component of the skin. It leads to depression in the skin, which is epidermal atrophy or dermal atrophy, sometimes even subcutaneous. Coming to the last, that is special lesions. These are certain lesions which, if you see, you can make a diagnosis, such as erythema purpurate, heel, burrow, comedone, milium, telangiectasia, sclerosis, poikiloderma, and target lesion. Erythema is the one where it blanches, it's redness which blanches on giving the pressure. It's mainly because of the dilatation of the underlying blood vessel. Whereas purpura is the one which doesn't blanch on applying the pressure. If you take a glass slide and press the purpuric lesion, the color remains the same. That is what we call it as non-blanching, and this is seen in certain conditions where there is damage to the blood vessels and the RBCs come out of the blood vessel and get deposited in the skin. For example, certain bleeding disorders, dengue, all such conditions you see purpura. Petechiae. Petechiae is something that's purpura which is smaller in size is called as petechiae. Ecchymosis is a larger purpura. Diastrophy is the one test which has the difference between erythema and purpura. Then we have wheals, which is hives or urticaria, and angioedema. Here the wheals are nothing but the evanescent erythematous elevated lesion due to edema of the dermis, frequently with central pallor or dermohypohidrosis, hypodermis with loose dermal tissue, example lips, eyelids, scrotum, that is angioedema. Here what happens is the skin, you see certain red elevated lesions, edematous lesions, which are very transient. It stays for a few hours and it goes off. That is what is wheals. Sometimes the same thing happening in certain sites such as lips, eyelids and scrotum, that is a condition which we call it as angioedema. The swelling can be seen at these areas. This is mainly because of the vasodilatation and increased permeability of dermal capillaries leading to edema. This is seen in urticaria. Burrow is something which is a wavy thread-like tunnel excavated in the skin. This is caused by scabies. Scabies is a very itchy condition where you see certain lesions called as burrows. Okay, and here if you see, that's particularly seen over certain sites such as interdigital space, wrist, genitalia in infants and very young. When we read about scabies, we can discuss about this in detail. Comedones are these are dilated pilosebaceous orifice plugged by keratin and sebum. This is one of the type of acne, whiteheads, blackheads, what we call. That's are open comedones and closed comedones. Whiteheads are closed comedones, whereas open comedones are blackheads. Milium is something, it's a tiny white superficial cyst with epidermal line containing the lamellated keratin, sometimes arise of blistered or damaged skin. So these are small cysts which contain degenerate. It's a cyst. It's a small white superficial cyst with epidermal lining. Telangiectasias are visible blood vessels. Small, visible, persistent dilatation of small capillaries in the superficial dermis that appears as fine, bright, non-concentrated, net-like pattern on the skin. May or may not disappear with diascopy. This sclerosis means it's a diffuse induration or hard thickening of the skin due to dermal fibrosis. It is seen in systemic scleroderma or morphia. Target lesions are something which are called as specific because they have this bullseye-like appearance. They have target lesions. There are three zones. Central dusky blistered or purpuric zone, my middle pale of zone of edema, and then outer erythematous zone of well-defined H. This is in EMF, that is erythema. So that's the end of this class, which is very briefly I told about all the conditions. We will be going in detail of individual conditions in coming classes. This you can go through these slides and make a note of all the type of lesions. It will be useful when we talk about these lesions in detail in the coming classes.